and then we'll put out some information for the day and for the weekend.
Thank you, Jamie. And thank you for being here. Good afternoon. In addition to providing a COVID-19 update today, I have some updates regarding the operations of LCG. Dr. Tina Stefanski and Dr. Ken O'Day, our coroner, are with us here today to answer your medical questions. Today, Lafayette Parish has 276 confirmed cases of COVID-19, and that's on 5,136 tests administered. We have not reported additional fatalities, but as we've communicated before, we expect that to change as the notification process is completed. We are beginning to strain the availability of ICU beds, ventilators, and PPE throughout Region 4. Our healthcare stakeholders are working on plans to extend our capacity, and we will provide that information as it becomes available. It's more important than ever that we take social distancing seriously, that we wash our hands, and that we stay home whenever possible. Responding to the COVID-19 pandemic represents a public health and economic challenge on a scale that most people alive today have not seen. Across the country, we are engaged in a mobilization of our public health resources and engagement of our citizens on a scale not witnessed since World War II. We are in the process of a mobilization of economic resources at a level not experienced since the Great Depression 80 years ago. The economic challenges affect all of us. The public health challenges affect all of us, but especially our elderly citizens, some of whom may actually have lived through the Depression and World War II. Our government is responding at all levels, federally, on the state level, and here locally. Our nonprofit organizations and our private sector, they're also mobilizing. Our citizens are finding ways to contribute to this effort, and it is truly heartwarming to see everyone pull together and pitch in. Importantly, President Trump, the governor, and LCG are briefing every day to make sure our people have the information we need to make wise and prudent decisions about our own health and safety, our families, friends, neighbors, and those that we love. In today's circumstances, no one needs to go hungry and no one needs to be at war. We just need to be vigilant, wash our hands, and exercise social distancing. I'm pleased to share that while we focus on COVID-19, the operations of Lafayette Consolidated Government continue as much as responsibly and practically possible during this emergency. For example, we're making progress on our integrated drainage maintenance master plan. Earlier today, we had a conference call with drainage experts who actually engage in watershed maintenance activities so that we move beyond simply responding to service calls. We are developing a recurring maintenance plan that is transparent, encompasses the city of Lafayette, unincorporated areas, and our local municipalities, while also responding to service calls. Our ongoing efforts to improve our processes for getting the grass cut are proceeding. We are implementing our GOMO program that will allow private lawn service contractors to participate in this work, expanding our capacity while simultaneously controlling costs. I want our citizens to know that while we are focused on the COVID-19 response, that we are also working hard to maintain our level of service to our citizens in every safe and appropriate way possible. While we are proactively addressing our governmental challenges, we are laser focused on addressing the economic and public health consequences of COVID. Just yesterday, the governor formally extended his emergency declarations and stay-at-home order through April 30th of this year. And that is in line with federal guidance from President Trump. The order has expanded to include closing of all public playgrounds in the state. Locally, I'm working with our mayors, my fellow parish presidents, along with public safety leaders to communicate practical social distancing guidance in cooperation with our major retailers and home improvement businesses. But listen, as Americans, we have always demonstrated our ability to respond to emergencies and to rise to meet our challenges. We are strong. We are united. We are courageous at every turn in our country's history. And today is no different. There is nothing we cannot accomplish together. As citizens of Acadiana and Lafayette Parish, we come together in times of crisis. We care for each other. We share resources. And we emerge stronger and more united than before. This weekend, while we're spending time with our families at home, let's use this time to be productive. But while we find ourselves fighting an enemy we cannot see, we don't have to see it to defeat it. We will adapt, we will overcome, and we will have victory over this virus. Any questions? If there are no questions for me, we do have Dr. Stefanski and Dr. Odene. Any medical questions for? Oh, you have a question for me?
I have a question.
Yes.
So yesterday, y'all put a call out to folks who were in need of utility assistance to go to Share the Light. I was on a call this morning. It sounds like Share the Light kind of just doesn't have the money. Like, there's concern that the amount of demand that we're going to have for utility assistance, rental assistance, you name it, is just growing astronomically. So what are you guys doing to prepare for that? What do you see LCG's role is in stemming that tide?
Yeah, there's no concern. Any other questions?
You mentioned working with stores on social distancing efforts. I know many have put out, 6-foot tape. Are you talking about what other places have done, like limiting the number of shoppers in stores?
So we're working hard with our stakeholders, but more importantly with our local businesses. And again, Neil, we are interpreting an order that, and I say we, my fellow parish presidents, my fellow mayors, we're all interpreting an order that we didn't get. But our governor's office has been very helpful in interpreting his order. The Office of Homeland Security, both locally, here Craig is with us today, but also the governor's Office of Homeland Security and Emergency Personnel has worked very, very diligently in giving us guidance so that we can adequately interpret the governor's order to our people. So the best way to tackle that is communication. We have these one-on-one examples as we saw with Walmart and Hobby Lobby and these other retail stores. As you see the communication increase, you see the participation, the proactive participation from our stores in exercising social distancing. I can't tell you the amount of stores that I go in as when you see the 6-foot tape, as you mentioned. You see the one shop, one buggy, one person rule. Walmart, I'll give you credit for that. I believe you're the first store that I heard utilize that, and it's started to catch on to our other retailers. But again, for all our business owners out there, common sense measure. We talked about this each day this week. The number one line of defense starts with us. So you as business owners have a duty. You don't need the government to tell you this. You got this. You're successful business owners because you've exercised common sense in the past. You have exercised business acumen. Now I need you to be on the front lines. We as leaders need you to be leaders, to be on the front line to promote social distancing. But I'm seeing more and more of these examples. So I'm happy. I'm not fussing. I'm encouraging you to continue these practices. While we're on this subject, right now there are a lot of businesses in Acadiana that have been deemed essential, and you're operating. To all our business owners out there, I want you to dig really deep. Some of you have vendors. You have to place orders for supply and services each day that you're open. I am challenging you to shop local yourself. Find local vendors. We are in an economic downturn due to this virus, but it's an economic downturn that we will get through. But just like the first line of defense on a medical standpoint, from exercising social distancing, from an economic standpoint, go out there, find local vendors, and use them. Any other questions of me?
Could you elaborate
Yes,
what you mean by that when you say there's no concern?
No. Any other questions?
Can you go over what are you guys doing to get in more ICU beds and other equipment?
Great question. So I will defer to Dr. Stefanski. Would you care? Before Dr. Stefanski comes on, are there any other questions to me? Yes, ma'am.
How many LCG employees have tested positive for coronavirus?
We wouldn't share that, Claire. I mean, it's privacy because it's a privacy concern. And And if you were an LCG employee, I don't think you would want me to share that as well. Okay. Any other questions? All right, thank you, Dr. Stefanski. And also, again, we have our coroner here today, Dr. Odene. So I appreciate all that you do. And remember, we are Lafayette Strong. May God bless you. Thank you, Doctor.
Thanks. Hi, so I believe someone had a question about ICU capacity.
Yeah, like what are you guys doing to bring in more ICU beds and more equipment?
Okay, sure. So, and I think we talked about this before. Our hospitals plan, all the time for medical surge. So, finding ways to increase the capacity of our healthcare system to care for a huge number of patients that might present for care, or a number that exceeds their typical capacity. So, I don't want to go into real specific plans about what different facilities are doing, but I can tell you as a region. So, we're planning as a region. How do we care for individuals who might present and need to be hospitalized? And there's just so many different things that we need to look at. So you look at space, supply, and staff. So the federal government, CMS, insurance companies, they're all working to lift restrictions so hospitals can do some things to increase availability of space within their walls. So increase places in their hospital system where they can put beds, increase ICU capacity again within their systems. And then of course we're supplies, so we know we've requested ventilators from the state and federal government. Lafayette has started to receive a few, and those have been allocated to hospitals that are seeing the highest acuity patients, so the patients that are most sick and most in need of those ventilators. And then staff, of course, that's a precious commodity. And when we talk about surge, usually we're planning for a mass casualty incident or a hurricane. So we might be the only region or community in the country that might be affected, or one of only a few. So you can imagine we're competing with the rest of the country for these resources. So for supplies, for staff, and the health of our staff is, of course, the medical staff or a high-risk group for exposure. So back to what our mayor president said, we need our community to really step up. We do not want to have to get to a point where we're surging and taking care of individuals in facilities in ways that we don't typically care for them. So we need people to realize that now is the time to be serious, to make sure that you follow these social distancing guidelines, stay home, because we know as we've seen increase the number of cases, we know there's more virus circulating in this community. We have no idea how many people in the community are infected because we're not testing asymptomatic individuals. So we have no idea what the load of virus is, but we know the more you're out and about, the greater your risk of exposure and the greater risk of you exposing other individuals. So just please ask people to understand that healthcare, we've got a super healthcare community. Dr. Odene is one fine example. But it's not fair to the healthcare system and to those hardworking nurses, doctors, housekeeping staff, for the community not to do what we can to help to reduce the exposure that we will give to them if you present into a facility with this virus. So again, just a long answer to say that our community has been, our healthcare community is on top of this. Our parish officials are on top of this, our state officials. But it's back to, I think, the important message is that people at home need to do their part as well.
Resources that, of course, allow us to track who has been infected or how many cases. Is there any resources to track what the recovery rate is, maybe, of some of these people?
So we're so early into this. The national, standard or the information that we've got is once someone's admitted, their typical course is about 10 to 13 days inpatient. That's a long time. That's a long hospitalization. And we know that we're continuing to see an increase in the number of people who are hospitalized and are in the intensive care unit in Acadiana. So there's some very sick individuals who are hospitalized, and again, very, very long stays.
Are we seeing any clusters yet inside of Region 4?
Yes. So clusters, and that's happening all, we do. So we actually call each individual who tests positive, and we go back through the 14 days prior to them developing symptoms and to what has their actions been since they have developed symptoms. And we're making lots of links. And I can tell you, in talking to those individuals, they tell us the same thing. Some of these individuals their only place that they go is to the store, to the grocery store. So, back to the one buggy, one person, when you go to the store, please keep your distance from other people. So you only go to the grocery store. I think the governor said, try to go only once a week. Don't go every day because you're bored. Don't, just again, restrict the times you leave your house to only when it's absolutely necessary. Because some people are only going when it's necessary, and they might be the person that you expose. So yes, we're following up on all individuals, and we definitely see where people are still gathering. So just because it's your friends or your family, and you think it's okay for all of you to get together, that's still not the right thing to do. And when you do get together, keep that distance of 6 feet apart. If you've got older parents, I know that's really hard, but visit with them outside. Keep distance. Don't have big family gatherings or gatherings of friends. This is just unfortunately not the time to do that. So when we say clusters, yeah, we definitely are seeing connections of cases.
We've heard about a possible cluster at an Arnaville nursing home. Can you comment on that at all?
So I thought Claire was going to ask me that question. He beat him. So we are no longer, as a state, when this all first started, the state, LDH actually released the names of nursing homes where we're seeing cases. So that has stopped. So now it's all going to be reported at the state level. And I'll tell you lots of reasons. The reason to me that's most important and that makes the most sense, and this was not my decision, but makes the most sense, is that we want nursing homes to report to us when they have cases or suspected cases. And so of course the fear is that if you start to name facilities, then people may be hesitant to report. Because what happens when we do find out of a suspected case, well, first of all, our public health nurses are working with nursing homes right now every day talking about the infection control practices. But when we do have a suspected case, then that we take it to a different level of working with them to be sure that there's no further or there is no spread in a facility.
Wait, we've got like 20-something across the state that we've already announced, but now y'all are cutting it off.
Yes, and so it was actually released at the state level and in the press conference.
The governor, who made that decision?
I don't know who made that decision. And Dr. Odney is here too.
Okay, I got one. And maybe it's Dr. Odney. I don't know who would take this, but so we've found there's someone here who was tested at the Cajun Dome 16 days ago. Still have not received results. Got very ill. Went to Lourdes, got tested, got the test back in 3 days, and they're positive. Why is it still taking?
So
because it's taken 2 weeks to get tests back.
Right. So unfortunately, what was happening a couple of weeks ago is, and I hate to speak on the behalf of any company, but I can tell you what the supposition is that one lab really has been overloaded with lab tests from around the country. So that lab has opened an additional facility, and so now all of our tests are going to another lab. And those test results are coming back really much quicker, in a couple of days. And so unfortunately, there are several people who I'm tracking who are in a queue who are still waiting for results. And you're right, Claire, it's very disappointing. It was just a result of so many lab tests being sent to one facility in a short period of time.
There's they don't have a lab here.
No, so there's no labs being run from most facilities in Lafayette. The hospitals are able to do some testing in-house, but commercial labs, those hopefully over the next couple of weeks, you'll start to see more labs being done locally. But most are still send-outs.
All right. I'll try to be quick. Cajun Dome screening site update. Hours of operation at the Cajun Dome screening site are changing. As most of you know, healthcare workers at the site also work in our area hospitals. And as those COVID-19 cases continue to rise and those hospitalizations increase, we need to keep those healthcare workers healthy and prepared for the busy months ahead. Now, this doesn't mean that we won't be conducting as many tests. If you don't get to go on a day that it's closed, you'll go the next day, and you'll likely see on those days that we're open an uptick in the number of cars coming through. This weekend, the site's going to be open tomorrow from 8:30 to 10:30, but will be closed on Sunday. Next week, it will be open Monday, Wednesday, and Saturday. This is to accommodate the Good Friday holiday. Monday, Wednesday, and Saturday from 8:30 to 10:30 a.m. The following week, beginning April 13th, Monday, Wednesday, and Friday from 8:30 to 10:30 until further notice or any changes are warranted. So again, I sent that information out yesterday. So if you have any questions, let me know. As always, the 311 call center is open 24 hours a day for anyone concerned about whether or not they should be pre-screened. Dial 311 option 1 and you'll talk to a medical professional. Call 337-534-TEST, and I'm not going to freak out, but there's a spider. Okay. Not anymore. Sorry. Not a big fan. Outside of the parish, 337-534-TEST. Screening site today, 71 people went through the screening site, 7 were screened out, and 64 were tested for COVID-19. To date, since opening that site, 1,089 people have been tested. As far as 311 call center goes, yesterday medical staff answered 281 calls. 40 people were sent to be screened at the Cajun Dome. 24 of those calls were non-medical related. 23 were general COVID-19 questions. 16 people were sent to their primary care provider. 2 were sent to the emergency room. 13 were sent to urgent care, and 16 people were instructed to self-isolate at home. Remember, call 211 for general COVID information, 311 option 1 to talk to medical staff for pre-screening. Now 311 option 2, the LCG LIDA Business Call Center. Lafayette Economic Development Authority is an invaluable resource to get help over the phone for employers, employees, and those who are no longer working or looking for work. Since connecting LIDA staff to callers using the 311 call center, which opened Monday, 362 people have utilized that call center. Again, that's 311 option 2. LIDA handled 40 calls today. 18% of the calls were people asking for guidance on SBA loan information. 27% of callers needed unemployment insurance information. 13% of the callers were calling about the stimulus, which was announced yesterday. Those checks might be coming sooner than the original 3 weeks. 5% were looking for work. 5% were artistry, industry workers, those types of workers. And 23% were other types of call. Through the drive-through, we had 6 packets on SBA picked up and 3 on unemployment. Now, just a note, the call center and the drive-through will be closed this weekend. We'll reopen Monday from 10 a.m. to 2 p.m. The drive-through is located here at 705 West University, City Parish Hall, if you prefer to get that information on paper. That does not include the medical part. That is strictly option 2. You can still call option 2 and you can leave a message. But 311 option 1 to talk to a healthcare worker about pre-screening, that will be open 24 hours a day. We have some unemployment figures, not specifically for Lafayette Parish, but for the region, which includes Lafayette, Acadia, Evangeline, Iberia, St. Landry, St. Martin, St. Mary, and Vermilion parishes. New unemployment claims received going back to the week of March 1st. That week saw 1,255 claims. 1 week later, starting March 8th, 1,803. And the next week, right around the time people started shutting their businesses because of the stay-at-home order, the week of March 15th, we saw it jump to 7,060. Looking at daily claims between Sunday, March 22nd through Wednesday, March 25th, a total of 46,356 unemployment claims were made. For guidance on how to apply for unemployment insurance, again, you can go to LIDA's website, lafayette.org. Transit system routes are changing to minimize the risk to employees and passengers. Beginning this Monday, April 6th, 9 buses will run during the daytime from 5:45 a.m. until 5:15 p.m. Those routes will mirror night owl routes, but will have a 30-minute departure from the terminal. Additionally, Route 20 will run every hour beginning at 6:15 a.m. with final departure at 4:15 p.m. Night owl services will begin at 5:30 p.m. and run until 9:30 p.m. with final departure at 8:30. Bus fares have been waived. And a reminder to passengers, please embark and disembark using the rear door to minimize contact between you and the driver. Buses are disinfected and the transit system minimizes seating to follow social distancing guidelines. A lot of you had questions about the lunch program, the free lunches. We were using a ticket program for the last 2 days to track and kind of pre-screen those who were coming through. We have stopped doing that for the future lunches. So again, tomorrow at 11 a.m. we'll continue to hand out lunches at the Robichaux Recreation Center on Eras Landry Road. 2 meals per car are allowed. We will go back to the honor system, but this is geared towards employees affected by the stay-at-home order, including hospitality industry, service industry, and retail. Again, it's 11 a.m. It is first come, first serve, 2 meals per car. Share the Light program. We understand it's a tough time for many people. And yes, the Share the Light program has seen those funds go pretty quickly since we've put that word out yesterday. So we are encouraging folks to donate when they pay their bills, whether you pay using a paper bill or online. Again, the Share the Light program has run low on resources since we put the word out yesterday. We are encouraging people to pay, if they can, pay towards that when paying their bill online or on paper. Now we'll circle back to some more LUS information in 1 second. Parks, playgrounds. Playgrounds are closed. Do not take your children to the playground. Even if there's nothing barricading it, it is very explicit in the governor's order that playgrounds are closed. They are a breeding ground for germs, and you don't want to put your kids through that. So we've been getting calls about businesses going door to door, placing flyers or door hangers. Please do not do this. It's dangerous for the person doing it, and it's dangerous for the residents. I'm sure the chief and all of the fine officers behind me would agree that you probably shouldn't do it. If you notice someone going door to door, notify the authorities. LUS payments. Again, we are waiving disconnects and late fees on Lafayette Utility System customers, electricity and water. LUS Fiber is waiving disconnections for those customers, not late fees. We encourage you, if you can pay, to pay. As far as LUS goes, they haven't seen a dramatic increase in people who just aren't paying. It's right on par with previous months, but again, there's a limited set of data as we go into this month. When this last month's bills start to come in, we could see an increase in that. LUS Fiber, however, has 581 accounts that have not been paid, approximately $10,000. However, 102 account holders have established payment plans. That is what you are encouraged to do. Rather than let your bill build up to thousands of dollars to where you're in a position where you may not find work right away, try to set up a payment plan, even if it's a minimal payment, and they will work with you. So you're encouraged to call those respective agencies to set that up. With that, we'll have time for a few questions. Katie.
I have a viewer asking, why are the water towers being covered?
Well, before all of this happened, they were being repainted.